What do you think about, I guess we talked about chiropractics, we talked about the acupuncture. What about herbs? How do you use herbs in pets? Do you do teas, tinctures? I guess it depends on the animal and the size, but what's the most common, I guess, conditions you use herbs for and the most common administration method?
I would say it's pretty even to talk about the administration, probably pretty even between tinctures and tablets. Some powders as well, but I've got a company that I use tablets, some Chinese herbs with that the pets. For me, the biggest thing is that ease of administration with quality, of course, and eye toward quality. But if our patients won't take the herb, then there's no we're not going any further than that. So it's got to be okay for the owner to administer, and it's got to be okay. The pet's got to accept it, and then of course cats are a whole nother universe. We've got to just beg and plead to make sure that they'll take theirs. And we're using. I don't like to have owners have to physically put the pill in the cat's mouth. So some of our cat owners will do that, and they're willing to do that, and their cat seems compliant. But we try to stick with tinctures for them to make it easier. But I'm going to say again with our patient population, everybody's getting some herbs. If they're a senior pet and they just need something along the lines of an adaptogen, some organ support, we're doing that. If they're arthritic and have some pain, we're probably adding herbs in we're for sure adding herbs in to help with that. So we're addressing everybody's needs with some sort of herb and nutritional therapy for sure. It's just so vital for us in the way we work that they really need that, in my opinion.
It's great to hear that the herbs work so well with animals. What are your favorite herbs to use, just generally, like the ones you use most commonly?
Just thinking about just again with our caseload and a lot of older arthritic dogs, I get a lot of dogs that are weak, so we use a lot of ginseng. I feel a connection to ginseng here, and we're not in Appalachia, but we're kind of at the top end, and I feel a connection to using that plant. I really like it, and it seems to do well for our patients. So I like ginseng. I use a lot of ashwagandha. We use a lot of Corydalis for stiffness and Boswellia. And we use a number of Chinese formulas. We see a fair number of allergic pets as well that we use Chinese formulas for. But when I'm thinking of Western herbs and singles, for us, those are the big ones.
What about any specific combo or synergies that you like? Is something come to mind or anything along the combo?
Well, I should say the other thing that I didn't mention is that now that we've got access to hemp and CBD, we use a ton of that as well. Our problem with our pets is the cost, of course, for a quality product, but I'm a big believer in the effects of hemp. And so we'll combine hemp CBD I can make an argument for using that with most anything else that I'm using or for whatever condition I'm treating. So, and fortunately for us, a lot of owners are aware of that and want to use that. Probably, again, with our patients, we're using some bit of Corydalis or Boswellia along with some ginseng for strength, and probably my biggest combination along with some CBD.
Yeah, it's a great reminder about Corealis too. I often forget about that herb, but yeah, definitely a magical plant with that anodyne potential. Okay, great. Thank you for running us through the sort of modalities that some viewers and some pet owners might not be aware of out there. I guess where we're going to shift to next is medicinal mushrooms. So I'd like to hear your opinion on when you think they're indicated, when you use them, and how you use them, and maybe generally what kind of dose, depending on which size of animal you're working with.
I love using medicinal mushrooms, and it wouldn't be flippant for me to say that if the pet is coming in the office, they probably need them. So they figure into almost, I would say, 90% of the pets that we see have a need for medicinal mushrooms. So I'm a big fan of the Five Defenders formula. And again, for our canine patients, they tolerate a capsule very well. So that capsule is a really good way of delivering that. It's not difficult to give. The pets tolerate it really well, and I think that it works quite well. When we get down into the cats, of course, we don't the capsule is way too big and a way too big a dose. And so we'll use some of the powder and just, try to get a touch of the powder into them, maybe even a eighth or a 16th of a teaspoon, even once a day. If I can manage that, then I think I'm doing pretty well for some of our feline patients.
Most of the pets you see coming to you, you said are, you see an indication for the medicinal mushrooms, whether that's the five defenders or other things. But what are some of the conditions that you see maybe respond well to them, if any, or maybe conditions that you don't use them that you think they're maybe contraindicated in?
I can't really think of anything where I wouldn't want to use them. Sometimes I have to prioritize based on finances or based on the things. I try to be pretty low key in my prescribing, and so if I see a new patient and I feel like I've got a list of 10 things I'd really like them to use, maybe we send them out with a couple things to get started, and then we move on from there. So depending on if I'm just thinking of it as an adaptogen, maybe that's falling down the list and getting added in later on. The cases that it is an immediate addition for me is for our cancer patients. When they're coming in, and whether or not that pet is getting traditional chemotherapy or radiation or some combination of that, or they're not, whether that's the owner's choice based because of their philosophy or because of cost or just because we do have some cancers in pets that don't respond to or don't respond at all or very little to the traditional offerings. We can usually start getting mushrooms into them along with some herbs and other things, and really improve their quality of life pretty quickly. That's a class of patients that I really like to use the mushrooms in for sure.